This podcast is sponsored by Orchid Live. Orchid Live is a specialist occupational health software used by a number of SOM members to run every aspect of their occupational health operations. They hold healthcare records for over 1 million UK workers and work with both in-house OH teams and OH providers. You can find out more at orchidlive.com.
Hello and welcome to the Global CMO podcast. I'm Dr. Lara Shemtob, GP and occupational physician, and I'm joined today by Dr. David Rooms, Chief Medical Officer of the biopharmaceutical company Bristol Myers Squibb.
Thanks, Lara, and thank you very much for inviting me to join your podcast.
You've worked within a number of critical industries, all these different global locations, and it's going to be really relevant to our conversation today because in this podcast series, we're really exploring what work and health means to some of the most innovative organizations from a range of different industries operating across the globe. And we want to pay particular attention to the role of occupational health in organizational success. So I'd like to put that to you in your current role at BMS. What do you think about how your organization defines health and well-being for the workforce there?
It's really the killer question in terms of, because this is the question that, you get asked by the people who are allocating budget and funds, which is, okay, if we're going to make this investment in employee health and well-being, what's the return? We do try to educate decision makers regarding value versus standard ROI type calculations. I think there's been a bit of cynicism, or at least I've encountered some cynicism in my career around some of the claims that have been made historically about, for every dollar spent or every pound spent, you're going to get X multiple back. And then when you really start to sort of scratch the surface of some of those calculations, they don't always stand up to scrutiny. And then you're left looking slightly sort of sheepish in front of the board. So, it's really important that, when we're talking about the value of occupational health or the value of workplace well-being to decision makers, senior decision makers in corporations, that one needs to really frame the argument not just in terms of the bottom line, but also, I think, in terms of the moral arguments, which do hold sway, and also in corporate speak, the EVP, the employer value proposition, in terms of what is it that differentiates working at this company versus working at that company. And one of the changes that I've seen over my career is the world of work in the 25 years that I've been doing occupational medicine. The early career people have a different expectation today than perhaps people who started work back when I started work. So, people are much more likely to kind of query the mission of the organization, the value of the organization. Do their values fit with the organization that they're joining? And so where I'm working at the moment in Biopharma, these are typically folk who are very committed to patient care. So it's almost easier in sort of a health sector or a health adjacent sector to be able to tap into sort of the stated values of the organization to then make the argument that if we're making these investments in patient care, we need to be taking as much care of the workforce, and people get it. That's not to say that outside of healthcare, sectors that people don't get it, but the way people like us, the way we frame the value proposition, I think, is super important. And what I think doesn't work is, saying, well, I'm the company doctor and sort of, therefore I know or I'm right. In an organization, everybody is smarter than I am. At these senior levels, these are people who are not necessarily going to be impressed by a white coat and a stethoscope. What they want to know is, how do you add value? And I can give you some examples of how I've done that in previous organizations and here.
Yeah, that sounds brilliant. I mean, the idea of tying in the occupational health offer to the organizational mission and how that might vary industry to industry is really interesting. Also, the concept of employer value proposition. And I think in some of these spaces, there feels to be a bit of a dichotomy between where occupational health fit in that compared to other offerings in the employee benefit spectrum. I don't know whether you've had any experience of that in trying to unify an offering.
Yes. So, I mean, this actually leads into quite an interesting discussion, I think, around, organizational structure and where occupational health sits within an organization. And it is very different. I mean, I currently work for a US organization where the benefits side of the reward structure is quite different to, say, a UK-based organization where the majority of the employees sit outside of the US. In terms of where occupational health adds value in benefits design is very variable. And I know this from talking to, my network of colleagues who are corporate medical directors. Some have a very, very strong and healthy relationship with the total reward or benefit side of the organization, and they work as true kind of partners. Other colleagues have described much more tension between their role as the medical director and the kind of benefits/reward folk who have an HR background. And fortunately, I've always had an open door to providing input into benefits design. And I think it is crucially important that people with our background and experience are part of that conversation, particularly when it comes to the procurement of these services, because there is an awful lot of variation between different providers and the things that they offer in the health and wellbeing space. And if you don't have the training in critically evaluating medical evidence, for example. I mean, typically vendors in the health and wellbeing space claim, I think, 3 or 4 things. One is they will increase productivity, they'll increase engagement, they'll reduce sickness absence, and they'll solve world peace. And it's hard to evidence that. So, that's where we can really, really add value. And I think it's critical that where companies have access to that capability, that they leverage it, because otherwise it's a missed opportunity.
Yeah, for sure. In terms of the kind of slightly different landscape in the US, where, of course, employers also are the main route to healthcare access for the working population. And I think for about 50% of the US population overall, which suddenly flips their position on things like prevention to an even deeper stakeholder. Have you found that working in the US that somehow your occupational health expertise goes a lot further in trying to line up things like prevention?
So your point around prevention, absolutely. There's some interesting observations that I've encountered since I've been working in the US, though, the last 3 years, around, because the employer picks up the cost of healthcare, preventative care through to intervention, medications. There's a lot of added layers and cost that has led to a lot of criticism around the cost of particularly pharmaceuticals in the US. But all of that cost gets picked up by the employer. So, the role of the occupational health physician over here is heavily and deeply entrenched in helping to navigate a lot of that world. And we also get involved with what they call STD and LTD, so short-term disability and long-term disability, which have a different meaning in the US to what I'm used to in the UK and other parts of Europe. The practice and the role of the occupational physician, there is a lot of overlap, of course, in terms of what we do in the US and outside of the US, but that emphasis on the benefit side of it is markedly deeper. And it takes up certainly more of my team's time over here than it ever did in my UK team.
Yeah, I can see that. And I think it's kind of an interesting place to be, really, because certainly in the UK, for example, with the issues we have with high levels of economic inactivity due to ill health and issues with the efficiency of the National Health Service and increasing morbidity in the working age population, I think some people are wondering whether employers will have a bigger role in supporting people access healthcare, whether that will separate a good employer value proposition from the others. And perhaps we could expect the role of the occupational health physician globally to take on more of that with time.
Yeah, well, of course, you're referring to the Charlie Mayfield report where, he's recommending absolutely that, the role of the employer is greatly increased in terms of helping to resolve the crisis. I mean, I think it's not too strong a word to use, the crisis of people of working age who are not in work for whatever reason. And, I can absolutely foresee that the role of the occupational physician will become even more valuable and important in that. There's a massive opportunity for people in our profession to really help with this. But again, we need the support of government, and we need to be training more occupational physicians and occupational health professionals, not just physicians, to do this. Directionally, it's right to put the emphasis away from primary care because the GP can't possibly know anything other than what the patient has told them. So they don't get to see a balanced view of the workplace, and they're very, very time constrained. Why would a GP undermine their relationship with their patient by getting into some sort of argument with them when they don't even have the privilege that we have of being able to talk to the line manager and go out and see the workplace and see what people are doing? Globally, it's variable. The level of maturity of occupational health, Scandinavian countries, Northern European countries typically, have fairly sort of mature occupational medicine, occupational health provision. In other parts of the world, it may be either more basic or it's more sort of traditional, more sort of like school nurse type provision, which is a very kind of primary care, first aid provision.
Yeah, that's a really good point, actually, about global maturity and, of course, how things will evolve now that workplaces are evolving in directions that we probably didn't predict just a decade ago. On your point of value, it'd be really good perhaps to share an example or two about some of these points in your career where you can demonstrate adding value to the organization through occupational health.
Well, so if you think of the two universal risks, whether you are sitting in the boardroom or whether you're the newest, entry-level employee, mental health and musculoskeletal health are the two kind of drivers of morbidity, cost, absenteeism, presenteeism. Those are the two. They're obvious, they're universal, and they are where the opportunity sits to drive down some of those things. One of the solutions that I thought about at a previous employer was, well, let's get physiotherapy in, which kind of intuitively made sense, that early intervention, hopefully we could prevent things from progressing and early intervention. And we did it for a couple of years, and we weren't able to demonstrate any decrease in MSK cases, which was kind of counterintuitive. In retrospect, though, what I should have taken a more sort of scientific approach to it rather than just kind of getting a company in, doing physio, and then counting numbers at the end of it. What I did later then was to actually partner with some scientists, and we investigated the actual cost of musculoskeletal disorders to the company. And it's published. We published it in the Journal of Occupational Environmental Medicine. So people, if they just search against my name, they can find it. And what we found was it was costing us, we had a UK employee base of, I think, 20,000 employees. MSK disorders were costing us £50 million a year. That's a number you can actually go to the board and talk about. What doesn't work, or at least doesn't work in my experience, is coming up with mental health costs the UK economy X number of £1 billion a year. You get sort of blank looks when you do that. If you can relate it to the actual workplace where you are, and if you can speak to decision makers about this is what this is costing us, you can start to make the business case for investment. So we did that, we measured it, we came up with a number, and the next stage was to then put in place the intervention to reduce that. And that's the point at which I changed jobs. So there is no happy ending to that story. But I will give you an example of where we did demonstrate value, and it was very, very powerful, was we put in place a wellbeing framework with different tiers of accreditation. And we'd set ourselves a target that by year X, all of the sites, and I think there was, 50 or 60 sites around the world, all needed to reach a minimum level of accreditation. But what we found was that some people were highly engaged in this wellbeing project or framework. And although we'd only set a requirement that people had to get to the first level, I think half a dozen-ish sites just ran with it and went all the way to the top level. Like there's 4 levels in total. And this was really interesting. What I then did was I then looked at what kind of stood out about these sites. So we looked at different measures. We looked at how many safety incidents did these 6 sites have? What was their sickness absence rate? What was the rate of quality defects? What were their engagement scores? What did we know about people's intention to leave? We actually found that across all of those measures that I've just talked about, that these 6 sites hugely outperformed on those same measures those sites that we sort of had to drag across the finishing line. What does that say? Was this all because of the wellbeing program? Of course not. This is a correlation. But what it said was that a site that is well led, that leads for safety, that leads for quality, that leads for health and well-being, where you've got a site director or a site leader or leadership team that really understands the importance of good leadership, you get better outcomes, including better health and well-being outcomes. The real value of that was I was able to go then to the other site leaders and show them the data. So that was a rising tide that really lifted everybody's game.
Thanks for sharing those examples. The first example was also good because it kind of illustrates how difficult it is to see a cycle through on this and how difficult measuring some of these benefits and intangible benefits can be.
I do think AI is going to help us if we can access all the data and then join it up. I'm pretty excited about the potential of AI to start joining some of those dots that have been very, very hard to join before.
Yeah, are you seeing much of that in your practice in terms of how AI is changing how things are done, either kind of operationally or even from a employee-facing way to increase access to services?
Yes. So, where I work currently, we are all in on AI in terms of, the whole company. We all have mandatory AI training. Everybody has access to the very latest AI tools, and we're all encouraged to play and experiment with AI. There's a guy on my team. He's created an AI agent that provides sort of the latest travel medical advice. So when I think it was a family was relocating to India, you just plug in the ages of the people, where they're going, how long they're going for, and then the AI agent sort of spits out a whole kind of list of recommendations in terms of everything from health and hygiene stuff, vaccination requirements. It's still raw, but it's kind of cool. We use sort of a structured format for incident reporting, for example, and, we've created another AI agent. In the prompt, you just put in a few details of the situation, and then it creates a sort of a situation report, a SITREP type thing, which again, it saves a lot of time. On a personal level, I'm using AI every day. I use it for, if I'm giving any presentations, if I'm researching a topic, I'm giving a keynote at a conference shortly on AI. So I asked the AI, what's the latest in AI? And it's a great adjunct. We're not doing this yet, but I know of other colleagues who are using, for example, Heidi Health. Other forms are available, I'm sure. But, for note taking and, medical records and stuff, we haven't gone there yet, but I can see that we'll all be doing that soon. And then the area that I get the most bang for my buck out of AI in is taking minutes of meetings. So, when you hit record on Teams, it produces brilliant minutes with action points and reference to whatever materials were sort of shared. So these kind of use cases and applications are only going to get better. But I know I'm not at the forefront of this. There are other people who are far more experienced and qualified than I am, but it's exciting.
Definitely exciting. And I think what's quite interesting is obviously your organization is really encouraging the workforce to get involved and leverage what AI can do. And several of those examples, like, for example, a minute taking is revolutionary for people that might have issues with dyslexia, for example, or so we can already see some OH advantages. But I'm wondering, you're working at an organization where AI is being deployed at scale. It's clearly being deployed live in some settings in the work people are doing in all of these different teams at BMS. Are you starting to see any fallout from like human computer interaction that is evolving into, for example, stress because people don't really understand where they are in the loop, or they feel like they're supervising too many agents? Has anything like that cropped up yet from an OH perspective?
I haven't seen that, Lara. That's not to say that it's not a potential risk. I'm sure it is. But so far, I think people are very much kind of in the playing in the sandbox sort of stage at the moment where, they're experimenting, but not yet getting stressed out by it. Hopefully, if it's done right and done well, then, other than obviously, job insecurity and that kind of thing, it really should be unburdening people rather than burdening people.
Yeah, that's a really positive take. And as you say, perhaps where organizations are deploying it in like a stepwise way, there's plenty of opportunity to make sure things are being managed as AI is rolled out more and more. What's one thing you think that business leaders could do tomorrow to make work healthier and more productive?
Great question. Leaders set the tone in an organization, and what they model, not what they say, but what they do. I mean, what they say to an extent, but what they do is what people then follow. That's what they see as being important. If you can get your C-suite leaders and your most senior leaders in an organization to be good role models around health and well-being, then that really sets kind of the cultural tone of the organization. So it's probably an answer that's slightly different to maybe what people would expect, which is, invest in this or invest in that. But if you can create a culture of health and well-being at your organization, that is probably the most powerful lever that you have.
Yeah, I agree. And I've seen that in practice in terms of anyone can probably reflect on that on the different workplaces they've been in, and where there's been really strong supportive leadership, people leading by example and walking the walk when it comes to work and health. So thank you ever so much, David, for such an interesting conversation. We covered so much, and it was great to chat.
It was lovely to chat, Lara. Thank you so much.
This podcast is sponsored by Orchid Live. Orchid Live is a specialist occupational health software used by a number of SOM members to run every aspect of their occupational health operations. They hold healthcare records for over 1 million UK workers and work with both in-house OH teams and OH providers. You can find out more at orchidlive.com.